Hello, this is the National Academy's Committee on Guidance on PFAS Testing and Health Outcomes. As this is an open session, I'll start with our usual disclaimer for public sessions. As chair of the Committee on Guidance of PFAS Testing and Health Outcomes, I would like to welcome everyone to the second day of the committee's 5th meeting. I want to note that this is an open, on-the-record information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions, and it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the academies. For those of you not familiar with the committee process, this is the 5th of several planned public committee meetings. In the public sessions, we'll have the opportunity to hear from many experts in the field and receive public testimony. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee. And the committee must then respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the National Research Council before it's considered an NRC report. The expected report release is spring of 2022. Further information on the study, including future meetings, can be found on the project website on the National Academy's website. The committee is being asked to provide advice for clinicians about PFAS testing and how test results should inform clinical care. Additionally, our expert committee will examine the health outcomes associated with PFAS exposure and will develop principles clinicians can use to advise patients on exposure reduction. In this meeting, the committee will hear from experts on the contribution of PFAS exposure sources to human exposure, clinical principles for advising patients on exposure reduction, putative health effects on PFAS, and methods for evidence synthesis. During panel discussions, the moderator and committee will ask questions of the speakers. If you are viewing this on the web, you may send any comments to Liz Boyle at EBOYLE, that's eBoyle, at nas.edu. This meeting is being recorded. Available speaker presentations will be posted to the project website soon after the meeting. Today's session will focus on identifying strategies for communicating biomonitoring results and the opportunities and challenges with connecting biomonitoring to clinical care. The process will have individual talks by invited speakers, followed by panel discussions grouped by this topic area. Committee members can then ask questions via the raise hand function during the panel discussion. And we will close this public session today with public comments. With that, I'd like to turn to our first moderator, Erin Haynes. Dr. Haynes is a Kurt W. Derschel Professor in Preventive Medicine and Environmental Health and Chair of the Department of Epidemiology and Department of Preventive Medicine and Environmental Health within the University of Kentucky College of Public Health. Dr. Haynes works with community members to address environmental health issues and develop citizen science tools to enable environmental health research. Dr. Haynes received her MS in environmental genetics and molecular toxicology from the University of Cincinnati, and her Doctor of Public Health and Environmental Health Sciences from the University of Michigan. Dr. Haynes.